want to supplement that.
My name is Dr. Steve.
My name is Dr. Steve.
I'm a pediatrician in New York City.
I'm a pediatrician in New York City.
Polls show
that
between 55 at the lowest,
between 55 at the lowest,
and 70% of the American people would support single payer, universal health care, expanded and improved, Medicare for all. That's the Washington Post poll.
That's the Washington Post poll.
The CNN poll.
The CNN poll.
And other mainstream media polling. Shows that a strong majority of Americans support real health care reform. Easy to understand health care reform. Medicare for all.
Mic check.
Mic check.
My name is Mayor. I'm a teacher. I can get good health insurance for myself. But if I want to cover my child or my wife, it costs $800 a month. That's insane. I would essentially be working just for health care. When you look at all the problems in our economy, with unemployment and people hurting, if we were to just cover health care for everyone, we would have more jobs. We would have more money to buy things. Our economy would be in much better shape. And more importantly, it's the right thing to do. That was good.
I'm a doctor in the Bronx, in the poorest congressional district. My patients need jobs. They need affordable education. They need affordable housing. They need affordable health care. And it's these inequalities that make my patients sick. And just providing prescriptions is not going to make them healthy. When they can't get food on the table. And that's why I support Occupy Wall Street. And I hope everyone here can share some of their stories.
Are there any members of the public who want to speak out? Don't be shy.
I'm here today to support Occupy Wall Street.
There's a myth in this country
that
everything the private sector does is more efficient than what the government does. It's a myth. The most efficient health care in this country is provided by Medicare. One of the most innovative healthcare systems in this country. Is provided by the Veterans Administration. Every single day. Hours of my time. Is devoted to healthcare bureaucracy. Instead of to patient care. Enrolling every American. In the private for-profit healthcare system. Is not going to make the system more efficient. It's going to divert more money. To profit for corporations. And away from the men and women and children. For whom health care is a human right.
Health care is a human right.
Thank you.
companies
have
openly declared
that
they are less efficient than Medicare. The health insurance companies are complaining that they need more than 20% to go to their overhead, and administration, and CEO salaries, and profits. Medicare does it for 4%. That means 96 cents of every dollar goes to health care. The insurance companies, only 75 cents goes to health care. And under the great health care reform that we got, that's supposed to go all the way to 80 or 85%. And the insurance companies are complaining they can't do it. I have a solution. They should go out of the business. Improved and expanded Medicare for all. 96 cents of every dollar going to health care. Private health insurance is murder by spreadsheet.
Evil group in this country. Right now, they have the most lobbying money in Washington, D.C. They are a silent partner in the fact that we don't have universal health care. There is a bill that does not allow the government to negotiate drug prices with U.S. pharmaceutical companies. Drugs made in the U.S. Sold to Americans. Cost hundreds of times more. To people that the drugs are sold to out of the U.S. The pharmaceutical industry also promotes drugs illegally. And they admit to it. And they pay $1 billion in fines. And they do not skip a beat in their profit making. Let me end by saying, let's not forget about the pharmaceutical companies. They live down on Wall Street. They are about profits. Not patience. Thank you.
Mic check. What I wanted to say before I got into my sorry healthcare thing.
That I want to thank all of